Welcome, everybody. Thank you very much for joining us this Friday for a really special At the Forefront with Dr. Jess Heron, who is founder and chief executive of the charity Action on Postpartum Psychosis. We are going to be talking quite a lot today about postpartum psychosis, which is an extremely horrific condition that affects a much larger number of women than I think that most of us would realise. Jess will be giving you more details on it in a minute because I'm not an expert and I'm not the person to tell you, but it is something that we should all know about. It should be much more clearly talked about, and because it is something that you can be supported through and can recover from, but there are a tragic number of people who don't. So we're really looking forward to hearing more about this and the solution, because that is very much what Jess and Action on Postpartum Psychosis have, is a solution in how to deal with this horrific condition that affects more people than it should. Jess, as her background, she studied experimental psychology at Oxford and then did a PhD in perinatal mental health, which led her to being part of a research program. And she took over the research panel that the program was being run by and converted it into the charity Action on Postpartum Psychosis back in 2011. When it started, it was a very small organisation with just 2 part-time staff. They now have a team of 30. We backed them at the Fore in 2018. So we've known Jess for over 8 years now. And we are extremely proud of everything that she has achieved and extremely proud that we had any part in that. And it was admittedly a very small part but that we have been able to play a role. As an organisation, Jess will be giving us lots more details, but they do a whole range of things, but that includes peer support networks. They do lots of research. They run campaigns. They have, in fact, I think Jess will correct me if this is not the best way to phrase it, but they have written the NHS guidelines on how postpartum psychosis should be dealt with. So they have already influenced at a national level. But they are still on a very important mission, which is to make sure that no one faces postpartum psychosis alone. So Jess, thank you so much for joining us today. I'd love to start with you just giving us a much broader and a much more accurate description of what the condition is and the impact that it has on people and families.
Thanks, Mary Rose. So Action on Postpartum Psychosis is the national charity for mums and families affected by postpartum psychosis. It really is an astonishing, fascinating, and really very cruel, distressing illness. So after having a baby, about 1 to 2 in every 1,000 new mums will develop an episode of really severe mental illness. So the kind of symptoms a mum might develop, hallucination, so seeing things, feeling things, hearing things that aren't there, delusions, believing things that aren't really real, becoming very manic, so very elated, very high, could be very irritable, sometimes very depressed, or confused. Often a lot of fear, anxiety goes alongside it. Mums might feel that they don't need to sleep or aren't able to sleep. Some mums can become very catatonic, so they're barely moving, but what's going on in their heads is very detached from reality. So the symptoms that mums might experience as part of this illness are really wide, but some mums might feel that they've got special powers or to heal, or that they've won the lottery, or the baby is the baby Jesus, or some mums might forget that they've had a baby at all and believe that they're going through birth again, or some mums might believe that the world is ending or there's something catastrophically wrong with the baby. It can be incredibly risky when it gets to that severity. So mums might feel that they can jump and they won't be hurt. They feel like they've got extreme powers. So really the brain just completely stops working as it would normally. There are often some early signs. So although it can develop very rapidly straight after birth, there are often some early signs that that indicate a postpartum psychosis might be on its way. So feeling ultra elated, like supermom, writing loads of lists, feeling ultra spiritual, and some mums will say, I just feel connected to all the colours, or connected to the grass in some way, or signs have a special meaning, particularly for me. Mums are rarely aware that they're getting ill themselves. Quite often, they'll think that everyone else has the problem, that the world has changed in some strange way and they just can't explain it. But maybe their husband is getting ill and he's being very weird, or they've entered an alternate universe where everyone's behaving very strangely. So it really is down to partners, family members, friends, health professionals to identify this illness. Sometimes mums will notice themselves that something's desperately wrong, but it's rarely a considered, I must go and seek help. It might be a mum seeing themselves on telly and thinking, I'll dial 999, or so it really is down to our care systems and our community to get mums who develop this help very quickly. The I guess the unusual thing about this illness is it can affect mums with no previous mental health history at all. So 50% of cases are completely out of the blue to women with no risk factors whatsoever. Around half of cases will be to people with pre-existing bipolar disorder, and they can have been well for many, many years. But for some reason, the postpartum is a really high risk time for women who have bipolar disorder. And it seems to be a very specific relationship with bipolar disorder. There doesn't seem to be a greatly increased risk with mums with schizophrenia, for example, or previous depression without psychosis. We know very little about the causes. We know that for some reason it occurs at similar rates in all countries, all cultures, all backgrounds. There's very few, unlike many mental illnesses, there's very few psychosocial risk factors. So in quite stark contrast to postnatal depression. We think that it's triggered by the dramatic hormonal, biological, immunological changes that happen around the time of birth and lactation. There's possible links with preeclampsia, thyroid illness, infection, but as yet we know very little about the mechanisms of action or what's causing postpartum psychosis.
So just tell us a bit about the worst case scenario, which is what happens if people aren't able to access treatment.
Yeah. So it can be a very risky illness for women to lose touch with reality when they're looking after a vulnerable baby. So in the UK, we have mother and baby units, which are set up and designed to keep mums and babies together and treat them very quickly. Our health professionals, since APP's been operating, are very well trained to identify symptoms. But in some other countries, rates of infanticide are very high. We know that when APP started, so suicide was, when APP started, and still is, the leading cause of mums dying in the UK. And when we started, many of these, around half, sometimes were associated with postpartum psychosis. Today, we know that in the UK at least, there are actually very few maternal deaths caused by postpartum psychosis. And in the 15 years that APP has been operating, there have been so many changes, so many, care has improved, support has improved, understanding, information for patients has improved. So we know that in the UK today, there are actually, suicide is very rare, infanticide is rare. But in some other countries, particularly the US, rates of suicide, rates of infanticide are greatly higher. And we know that care systems in other countries of the world really need to improve. We know we've still got quite a lot more to do in the UK, but yeah,
You've made a massive difference already. I mean, it's amazing. Why is it that you think that postpartum psychosis was overlooked for so long and obviously still is in so many places? And I'm amazed that you say the US is significantly high. You'd have thought that they would be somewhere that would be on top of this, but clearly not.
I think that it was surrounded by so much shame and secrecy, so women didn't speak out about it. When I first started interviewing mums and families with postpartum psychosis, many of them would say, I was told never to talk about this outside my home. People were even nervous talking about it inside the family. This isn't something that we will discuss publicly. So it was surrounded by a great deal of personal shame for women that had experienced it. I think that it not being a formal diagnosis in ICD or DSM diagnostic criteria has really hampered awareness and research into it. And that's a campaign that we're working on at the moment. The DSM has agreed for us and a group of experts to write a draft chapter on what postpartum psychosis diagnostic criteria might look like. But in the absence of that, I think that it hasn't been considered a thing. When I first started, Birmingham was the only specialist centre for postpartum psychosis research in the world. And it's really been such an overlooked illness, and it's taken bringing women together with experience, supporting them to say this isn't okay. This illness, the solutions are simple, and it's not okay that the care I received was traumatic in itself. That I've been left to recover on my own. That there's no information. So bringing together women with academics and clinicians has been a really powerful way of addressing this illness.
So this feels like a fantastic moment to move into. Tell us a bit more about Action on Postpartum Psychosis, what you do, and the different facets of it.
Okay. So we're a national home-based organisation. 80% of our staff have personal experience of postpartum psychosis. Our mission is to improve outcomes following postpartum psychosis and reduce the number of maternal deaths due to postpartum psychosis. I guess our guiding principles from the point of setup were that everything we do it starts with research. It starts with research, listening to women and families who've experienced it, listening to service needs, listening to helping plan our policies, plan our plans of attack around how we're going to address these issues. And then the other absolutely guiding principle is that everything we do is informed by a really powerful collaboration between families with lived experience, leading academics, leading clinicians with expertise in postpartum psychosis. And I think that's been a really powerful way of not only bringing together all the expertise and compassion needed to develop high quality services, but it's also been a really powerful way of leveraging partnerships. So we can put together solutions, but then we work with the NHS, with academics, with the third sector to spread, to really make sure those solutions have impact. So we, over the years, it didn't happen all at once. We've developed national peer support services, and I can come back and talk a little bit about the kinds of services we've set up. We develop patient information and help other organisations get together their patient information on postpartum psychosis. We train health professionals from midwives, GPs, psychiatrists, mother and baby unit staff, perinatal mental health teams in best practice identification, care, support through to full recovery. We still facilitate research. We do a lot of awareness raising and stigma reducing around postpartum psychosis. And importantly, we have from the very start campaigned for mother and baby units. So I guess the guiding principles when we first set up were based on two really important studies. So the first study, at the point just before we set up as a charity, we trained a group of women with lived experience of postpartum psychosis in research methods, and together conducted a study of recovery and information and support needs. And so really the aims of the charity were to just address each of the areas that came out in that research in turn. And then secondly, was a really important survey we conducted. So we looked at care and outcomes for postpartum psychosis in 2010 in about 218 women who had postpartum psychosis. Found that not many were making it to mother and baby unit, but that the ones that were had markedly better outcomes. They were much more satisfied with their care.
Sorry, could you just explain to people, because I think I know what you mean by mother and baby unit, but am I right in thinking it's when you are essentially, you're in some kind of residential, you've been sectioned, but you're sectioned with your baby rather than being separated from, is that what you mean?
Yeah, so mother and baby units are really remarkable places to receive care. So they're compared to a normal inpatient psychiatric hospital, they're very homely. Mums are kept together with their babies and surrounded with a multidisciplinary team, which includes psychiatrists, psychologists, midwives, nursery nurses, occupational therapists. And they have specialist facilities for caring for babies. So milk fridges, places to express, places to bath the baby, which general psychiatric hospitals just don't. And the doctors there have very specialist knowledge of the special issues about care in the postpartum, which is really very different from care at other times. Not all women admitted there will be under a section. In postpartum psychosis, it's about half of women are admitted and agree to stay voluntarily, and half are under a section. But mums are kept together with their babies for care. And our research, both those two studies, shows, so when in our qualitative work, mums who didn't get to a mother and baby unit just felt lifelong anger at the care that they received, that they didn't feel was therapeutic, that they felt was frightening and damaged their ability to be a mum, and felt lifelong trauma and frustration about the kind of care they received. Whereas mums that went to mother and baby unit felt they were looked after well, that their needs as a mother were met, that they gained confidence in parenting and the parenting skills. And while they were acutely unwell, they had care to look after their babies. But as they got better, they were able to take on more and more of those parenting responsibilities. And then in our survey of models of care for postpartum psychosis, mums who'd been admitted to mother and baby unit felt much more satisfied with their care. They felt more confident in the knowledge of their health professionals. They felt more confident with their baby at discharge. They were more recovered at the point of discharge. So a whole host of outcomes were much better in mums who'd gone to a mother and baby unit, rather than all other groups. And at that time in 2010, the worst outcomes were in mixed sex general adult psychiatric units, which new mums felt were incredibly inappropriate and unsafe places to even bring a baby to visit.
So tell us also about some of the other types of support that your research has shown is completely vital in the care for people who are experiencing postpartum psychosis. I know you've got some fantastic peer networks, and you've also got an amazing model where you work with communities, particularly communities where there is still certain amounts of shame and stigma, and you've worked out a way to get into areas where otherwise it might be quite difficult to get the right sort of support.
Yeah. So when we started our peer support services, we knew that we needed that, this was important throughout the whole country, whether you live in a city, whether you live rurally. So our services started as email support and an online community forum. But over the years, we've developed, our forum now has 4,000 lived experience users and supports women throughout the world, for their lifetime, whatever stage of illness or recovery they're at. But we also have regional cafe groups. So in some of the larger city regions, we've got monthly groups where women can meet up and they get peer support, not just from one person, but from a whole range of people at, all different with all different experiences, all different backgrounds, and all different stages of recovery. We now offer UK-wide video call support with trained volunteers, and that was one of the things that the Fore initially funded us to do, which was incredibly prescient, but I think that was more by luck than planning that we set it up in the year ahead of COVID. And so when suddenly all of our services went online, we were really well prepared to manage that crisis. We run one-to-one, face-to-face peer support in lots of areas. And we also have specialist online groups. So I think these groups are really important because meeting someone with postpartum psychosis is hard enough, and we know how important it is. But meeting somebody, if you're, say, from the Black community who has had postpartum psychosis, who understands the perspectives that you're coming from, who might have the same religious beliefs, or so bringing together people with specialist knowledge really aids peer support. So we have a number of online specialist groups. We run a monthly group for dads and co-parents who our research showed that the experience for dads and co-parents was described as the most traumatic thing they've ever had to go through. They were just left uh, picking up the pieces, really, not really knowing what's just happened, feeling desperately responsible for the fact that their partner's just been admitted to a psychiatric hospital, trying to juggle care for older children, the home, work, and just really, in shock, not knowing what's happened or whether their loved one will ever recover. So we know how important our Partners Project is in just sharing that hope, sharing that expectation of exactly, what recovery might look like, exactly how they can provide support. And just knowing that they will get better, that this isn't a life sentence, that this will be, a really difficult few months, probably quite a tough year or two or three, but it will be, but people will get completely better and they will get to be the confident, able mums that they wanted to be. So we when we started, the rates of separation were quite high. So again, that was one really important thing in being able to support partners. So we also run a monthly group for grandparents, for LGBTQ plus families, for Muslim women and Black women, two separate groups. And that's because we felt that we weren't reaching enough women from the Black community and Asian communities. We knew that they had much worse overall outcomes. So maternal death rates are much higher. We did a study of pathways to care and experiences to look at the kinds of barriers that women face, and learned a great deal about the issues for women themselves, for families, and for care systems, and from that set up our monthly groups. But we also have staff and volunteers that do outreach work. So we'll go and share lived experience stories with community groups, train people in identifying postpartum psychosis. And today we're working on a study called the POSI study with Oxford University, looking at developing best practice guidelines for perinatal mental health teams to try and address poorer outcomes, and also partner with Motivational Mums Club on trying to support storytelling and helping stories reach the communities that they need to. We also have a bereaved families group, and a one-to-one service, and developed specific content around that. And I guess that was because a lot of families came to us wanting to fundraise, wanting to campaign, but we knew we weren't providing enough support for them while they were doing it. So we ran a project where we met with families, talked to them about what content they needed, what services they needed, what APP peer support might look like, how we add value to what other bereavement services offer, rather than try and replicate it in a different way. And then trained a group of bereaved partners, bereaved adult children who'd lost mums to postpartum psychosis, and developed a web resource around that.
You are, I mean, this story of what you're doing is just completely incredible, and your reach is now clearly it's national. You have changed the system, and I mean, I hope you feel extraordinarily proud of everything you've done, because it's so amazing. But for the people who are listening who are maybe not working in the same areas, you do something different. Tell us a bit about what advice would you give them on, how you've reached this kind of scale, and, what's your staff team like? How many volunteers do you have? Building the personal insights and experience into the model. Are the particular challenges or advice that you might have for people who are thinking about this in the context of their own cause? that would be useful for them to hear?
So I guess as I mentioned, I think that three-way equal balance between families, academics, clinicians is a really powerful way of developing high quality services, but also of reaching the networks and developing the partnerships that you need to. I think it's really important that APP is a home-based organisation. It helps us. There's massive benefits for parents of young children working from home. It helps us reach the best staff wherever they are in the country. And that's really important when we rely so heavily on lived experience staff. So all of our projects are managed by leaders with lived experience. And I think that's really important in them knowing the support that they need to offer to staff and volunteers. And it means they're so passionate about their individual areas as well. So a lot of my job is trying to kind of boundary and harness and set the order rather than saying, we're going to do everything all at once. It's trying to keep that passion for change in check and make sure it's done in the right way. So I think, the fact that we are a lived experience organisation and try and be a gold standard employer for working parents and parents with personal experience of severe mental illness has really helped. I think being a home-based organisation has massive challenges in terms of scaling, and I think that's about trying to get the right systems in place at the right time. But I think necessarily as you scale, you become slightly less flexible and responsive. And that's something that we really want to guard against, because I think it's so important that we have those networks that reach right to policymakers, so we know what's going on on the ground, because we've got our embedded projects in various mother and baby units. We've got face-to-face groups in regions. We've got our 170 volunteers around the country who are all outreaching to their local health professional groups, disseminating information, manning stands, giving talks to local health professionals. So we can kind of reach in and see what's happening, on a national level, and see the changes that are happening as they happen, but also be able to feed in to NHS England or mother and baby units to say, this is what's happening, this is what people are saying, how do we address this? And so those routes in have been really useful. It's a worry as to what happens next as NHS England winds down. I think it's really important that the new whatever is put in its place does still see perinatal mental health as a really important strategic area, and that needs national oversight, that needs coordination, that needs somebody learning from good practice and sharing good practice around the country.
For you as a leader, you have a background as an academic researcher, and it's extremely impressive academic background. But what do you find are the biggest challenges is sort of translating that into being a visionary and trying to corral an organisation of, an amazing number of volunteers and staff who, as you say, are all remote around the country. Have you got any advice to...
What do
you need help with as well?
as an academic researcher, I really had very little understanding of how to run a charity. I had lots of very passionate people and lots of knowledge about postpartum psychosis. When we started, my mum, her friends were all, running off literature on there, and we were meeting in their sitting room. Prof. Ian Jones, who was, the leading expert in postpartum psychosis, was there, was our first chair. And still remains with us as a trustee. And so we had a lot of passion from the families, the academic experts, but very little knowledge of how to run a charity. As we've grown, I think one of the key things is every post we take on is somebody that has better knowledge and better skills of a particular area than any of the rest of us do. So taking on our head of finance and operations, who came to us from an international development background and had so much knowledge about running a charity, was absolutely essential. I guess I had a lot of background in grant writing and research and analysis, but very little in the way of campaigning or knowledge about influencing MPs. So I think the important thing that we've done is every new hire has been somebody that that really increases the knowledge base of the organisation. I think our newest hire is a digital transformation lead, and I think it's going to be so important in looking at the next stages of APP and doing the groundwork, but they're
Yeah,
not normally posts that traditional funders will fund.
yeah, no, that is the biggest challenge, isn't it? There's so much conversation in the funding community around AI and AI transformation, but actually, will they fund what is really needed to make it happen is another matter. We've got a couple of questions that have come in around, do your research skills carry a big role in fundraising, and embedding research is what they'd like to improve in terms of fundraising, sort of similar question. But also I want to make sure that you have time to talk about what's next for APP. I mean, at that incredible event that you hosted 6 months ago now, I think it was, in London, you were talking about countries around the world that are coming to you asking for you for advice on how do we provide better services and better support to women who are going through this challenge. So yes, tell us about the future.
So I think we know that there's still quite a lot more to do in the UK. We still know that not all women with postpartum psychosis get to a mother and baby unit. And I foresee some risks in the next NHS 10-year plan about making sure that there's still an understanding that women with postpartum psychosis need to get to a mother and baby unit, that watch and wait, that care at home isn't appropriate for such a severe and risky illness. So I think we've got a lot of campaigning to make sure people around the country, policymakers, understand the risks involved in trying to care for people with postpartum psychosis in the family and in the community. It's just not appropriate. So we've got work to do around that.
Is there anything on that topic? We've got a lot of people on this call, quite a few of them might well have interesting connections. Are there any people that you can't get to that you would like to get to, that you can just put a call out to say, hey, if anyone knows X minister or X person, I'd love to be introduced to them?
Yeah, if anybody knows the right people to talk to explain the importance of mother and baby units in order to protect them, I would be delighted to try and organise meetings with our clinicians and groups of people with lived experience, just to show and bring our data to show exactly why mother and baby units need to be protected.
Do you know who those people would be? Are they the civil servants? Are they the...
Well, I guess new health ministers,
Okay,
civil
yeah.
servants, yeah.
Yeah. Okay, everybody on this call. That's what Jess needs help with.
Um, and fighting to make sure that perinatal mental health is still. So there was a really strong team in NHS England and overseeing perinatal mental health, and that's gradually shrunk. And I think we need to argue about the importance of it staying a national strategic area of importance with specific named oversight. So yeah, anyone that knows who to who to go to about that's very useful as well.
Um, Jess, we are almost at time, but before, we've got a question just dropped in. You've talked about working with the NHS England, somebody, Fiona, who's based in Scotland, and she's aware that mother and baby unit beds are very limited. Just wondering, do you work in Scotland and have you got any groups available?
Yeah, so we do have a Scottish cafe group that is mainly online, but sometimes meets up in person as well. Um, There are units in Glasgow and Edinburgh, but we know that the greater distance people have to travel, the less likely they are to get to a mother and baby unit. What we don't know is exactly why, whether that's because they're making the decision, not that it's too far for their family to travel, or whether it's that the health professionals further away from units don't know about these units or why they're important. But we know, for example, patients in the Highlands very rarely get to those two units. So Scotland has just agreed to increase the number of beds that they offer. They've taken the decision not to set up a new unit for further up in the country, but to increase the number of beds across those two units. And the argument behind that is that actually it's quicker to get to those major centres than it is to cross the top of Scotland. But I think there does need to be, once those beds are fully operational, there does need to be an understanding of whether there's still people that aren't getting, and exactly why that is. Is that because families lack the knowledge, or is it because health professionals lack that knowledge?
Thank you. We've got some other things coming into the chat from Mary Pappin. Thank you so much. You've got two very specific names of people you need to talk to in NHS. That sounds extremely useful.
Thanks, Mary.
And Ruby as well. So we are a Black-led mental health charity working on an NHS-funded perinatal mental health equity work stream. I just left her email address for you to contact, and somebody's asking for a copy of this recording. We will very definitely circulate this after, but we'll also make sure, Jess, that you get the chat so you'll be able to reply to people and connect with them on LinkedIn. But also, if you would be happy to put your email address, we can into the chat, then we could do that. I think I'm just going to read this out to summarize, basically. But Nicola, thank you. You have said, I have loved this. I'm in awe of all you have achieved and continue to do, Jess. She absolutely, Nicola, you sum it up. Whenever I meet you, Jess, and we talk about this subject, or I come to one of your events, I find myself quite overwhelmed with emotion because it is such an incredible thing that you are doing. And from, I think, the whole of the UK, you are saving lives, you're changing lives, and you are doing something totally amazing. Thank you so much for sharing so much of what your work is at the moment today. And, is there something as we finish that you would like to give as a kind of call to action to people who might want to help, might want to, even if it's just a please connect with you on LinkedIn and share our posts? I mean,
yeah, I think everything we do relies on really strong partnerships, and If there are touch points with our work, please do get in touch. Yeah, it would be great to have be able to increase our influence and reach the right people.
Fantastic. Thank you so much, Jess. Anybody who's listening, please drop your email address in the chat so Jess can get in touch with you. And Jess, on a Friday afternoon in the middle of August, well, no, the very end of July, we're not quite in August yet, but thank you so much for giving up your time to come and talk to us. And we are so proud to have been able to help you along the way and to be able to keep championing what you're doing at APP. It's amazing. Thank you so much, everybody. And thank you all for listening.